Male circumcision is a common surgical procedure performed for religious, cultural, or medical reasons. While often considered safe when performed under proper conditions, it is not without potential complications. Understanding these risks is essential for healthcare providers, patients, and caregivers alike. Complications from male circumcision can range from minor and temporary to severe and permanent. These outcomes may depend on the age of the patient, surgical technique, setting, and hygiene practices during and after the procedure. Age, technique, setting, and hygiene are key determinants of risk. Early complications typically occur within the first few days to weeks after the procedure and include the following. 1. Bleeding. Excessive bleeding is one of the most common immediate complications. It may be due to inadequate hemostasis or bleeding disorders and may require cauterization or suture intervention. 2. Infection. Post-operative infection can range from localized redness and swelling to systemic involvement. Inadequate sterilization, poor hygiene, or premature exposure to contaminants can increase risk. 3. Pain and swelling. Although some discomfort is expected, uncontrolled pain or excessive edema may signal underlying issues requiring clinical attention. 4. Delayed healing. Incomplete epithelialization or necrosis due to poor technique or infection can prolong recovery and increase the chance of scarring. Some complications appear after the initial healing period and may have lasting effects. Common long-term issues include 1. Meatal stenosis. This refers to the narrowing of the urethral opening, often seen in boys circumcised in infancy. It may result in painful urination or urinary retention and sometimes requires surgical correction. 2. Skin bridges and adhesions. Improper healing may lead to skin from the shaft adhering to the glands, forming skin bridges. These can cause pain or hygiene challenges and may need minor surgical correction. 3. Excessive or inadequate foreskin removal. Removing too much skin can cause tension and penile curvature, while removing too little may require revision surgery. Both scenarios may cause cosmetic or functional dissatisfaction. 4. Keloids and hypertrophic scars. In predisposed individuals, abnormal scarring can lead to raised or painful tissue at the incision site. Though rare, serious complications can occur, particularly in non-clinical settings or when performed by untrained personnel. 1. Glands injury or amputation. Injury to the glands, including partial or complete amputation, is a devastating complication usually resulting from improper use of surgical instruments or inadequate visualization. 2. Urethral injury or fistula formation. Damage to the urethra may result in abnormal passageways known as fistulas, which require complex surgical repair. 3. Sepsis or death. Although extremely rare, cases of overwhelming infection and death have been reported, especially in settings lacking sterile technique or post-operative care. Proper technique, sterile conditions, and careful post-operative care minimize risks. Prompt recognition and management improve outcomes. For trainees, learn technique, follow protocols, prioritize patient safety,